Hey everyone, Dr. Tam here. So since I did not give you a tip yesterday, today I'm going to give you 2 tips, okay? Now, one of the comments that I got from one of our patients, and he's maybe around 20 years old, he says, hey, Dr. Tam, a lot of your tips are geared towards older people. And I said, what do you mean? He says, well, you talk about exercises and the different stretches. It doesn't really apply to me. And I said, it absolutely applies to you. Because I asked him, do you want to live a longer life? He says, yeah. I said, do you want to live a longer and functional life? And he says, yes. Then I said, well, then you have to follow what I'm sharing with you, because everything I'm sharing with you, yes, it may be geared towards people who are 40, 50, 60, 70, 80, or 90, because a lot of what I talk about is how to live a better life, how to live a more functional life, about stretches and exercise, how to eat well. And he's like, well, it doesn't apply to people who are 20s and 30s. As if you don't take great care of your body now, you're going to have to end up paying for it later anyways. So you might as well start taking care of your body now. So, and I also feel like the 50 and above population are one of the most underserved populations in terms of health, in terms of nutrition. When they go to the doctors, most people are being told now that, oh, you just have old age, you're just getting older. That's why you're experiencing all the pain, all the aches, all the colon problems, And that's absolutely not true. It doesn't have to do with age. It has to do with what your body's been dealing with all the years building up to it. And I want people to know that just because it's common does not mean it is normal. Okay? So the first thing I want to talk about is, how do you allow your body to heal better, faster, longer? One of the things that a scientist in Japan, he discovered the body has something called autophagy. Okay, he discovered a process of autophagy in the body, which is similar to cellular cleansing. And one of the ways you achieve that is by intermittent fasting or time restrictive eating. What does that mean? That means you only eat within 12 hours or within 8 hours of a day, or in the more extreme, within 4 hours in a day. So myself, I've been practicing intermittent fasting for at least 4 to 5 years now. Like right now, it's about 1 p.m. and I haven't had my first meal. And my last meal last night was at about 7 p.m. So if you look at it, between 7 p.m. last night and 1 p.m. today, well, you're looking at about 18 hours of not eating yet. So most of my days, I only eat within a 6-hour period. So during that 6-hour period, I'm eating, but during these 18 hours that I'm not eating, my body's healing. When you're not eating, your body's healing. So make sure you remember that. So that allows your cells to cleanse, your stomach to take a break to cleanse, your heart and liver and your lungs to work better, because your body's not worried about digesting food. It helps with skin, collagen rebuilding, and it also helps with internal organ cell replenishment and cell. Part of it is cell death, because your body's cleaning out all the old cells, the dirty cells, the bad cells, and replacing with all the new cells. So intermittent fasting, look into it. It's really, really good for you. And the only time you want to kind of switch back and forth between intermittent fasting and say 3 meals a day is if you are of childbearing age. Intermittent fasting, you want to do that maybe 2 weeks on, a week off, or 3 weeks on, 1 week off. 3 weeks of intermittent fasting and then 1 week of just regular eating. And that will really get your body to, if you're wanting to lose weight, if you want to be healthy in your childbearing age as a female, you want that. But for guys and for ladies who are after menopause or premenopausal, it doesn't affect you as much. Hormonally, it doesn't affect you as much. So, it doesn't affect you at all, actually. So, try intermittent fasting. It can have a lot of great benefits. It works and helps with the heart, lungs, liver, allows your body to cleanse, longer living age and lifespan. Okay, that's the first tip. My second tip has to do with high blood pressure. So for those of you who have high blood pressure, what does your medical doctor usually tell you to do? They tell you to stop consuming so much salt, right? Stop eating salt, stop eating, sprinkling salt, don't eat salty food. And what happens is you end up being very lethargic, you feel tired, you wake up tired, in the afternoon you get tired. And what happens is you become salt deficient. See, as a body, as a human being, your body needs about 2,400 milligrams of salt per day. So if everything that you eat is low salt, low sodium, what happens is you end up having a really bad sodium and potassium imbalance. And there's a pump in your heart called the sodium potassium pump. And if that salt content is not in there and you have a huge imbalance, your heart's going to stop functioning. It's going to stop functioning very well. So that's why there's so many people who are taking high blood pressure medications. They take salt out of their diet, and yet their high blood pressure never gets any better. What you should look at is not so much taking out that much salt. You have to have 2,400 milligrams a day. Is to make sure you also look at potassium. Remember that sodium potassium pump I was just talking about earlier? You have to have 4,700 milligrams of potassium every single day. So the number on salt is 2,400 milligrams. The number on potassium is 4,700 milligrams. You almost need twice as much potassium as you do salt. And I think one of the biggest problems is the fact that most people are not consuming enough potassium, which is in our green leafy vegetables. Not too much salt, but the lack of potassium, okay? But the next thing you also have to look at with high blood pressure is removing as much refined sugar and starches in your meals, right? Cookies, muffins, pancakes, sodas, juices, you gotta start removing out of your daily lifestyle. Too much sugar causes insulin resistance, which in turn can cause even worse high blood pressure problems. All right, don't just pay attention to salt. That's one of the myths, is too much salt. Okay, I really hope those 2 tips help. I think I've talked about it in detail. Ask me questions, comment below, make sure you subscribe. My goal is this year, every single year, or every single day, 365 days a year. And if I miss a tip, I'm gonna make it up on the next one. Is I do a lot of research. I have a lot of different knowledge on different things. And I like to share different tips on how you can surpass 100 years old functionally. All right, until next time, have a great day.